Hi, my name is Angel. Let's study neck and muscles anatomy together. Alright, so let's start with anterior neck muscles. In this video, I'll also be giving you some mnemonics, right? Alright, so the anterior neck muscles are a group of muscles covering the anterior aspect of the neck. This is the anterior aspect of the neck, right? They are further divided into three subgroups, right? So superficial muscles are the most superficial in the anterior neck and include the platysma and Sternocleidomastoid. So you can remember the plate is shiny for platysma, right? Uh, that's, the plate is shiny, so P, platysma, and sternocleidomastoid, shiny, all right? So these are superficial muscles, right? So you can remember this mnemonics. The suprahyoid muscles, as the name suggests, are found superior to the hyoid bone. This is, as you can see, the yellow bone is a hyoid bone, and include the digastric, mylohyoid, geniohyoid, and stylohyoid. So did my genie stay? Alright, so that's the suprahyoid muscles. Superior to hyoid bone is suprahyoid muscles, right? So did my genie stay? Alright, so D for digastric, my for mylohyoid, Genie for geniohyoid, and stay for stylohyoid, right? So that's the suprahyoid muscle. Also remember that did my genie stay is from the movie Aladdin, and Aladdin had a famous carpet, right? So genie is on the carpet, so it means superior to hyoid bone. Okay, so that's a did my genie stay? All right, so did my genie stay above the carpet, like that? Okay. Infrahyoid muscles are found inferior to the hyoid bone and consist of sternohyoid, omohyoid, sternothyroid, and thyrohyoid. Santa, oh Santa, thank you. Alright, so infrahyoid muscles inferior to hyoid bone. This is the inferior part, right? Are found inferior to the hyoid bone and consist of sternohyoid, so that's Santa, omohyoid, that's O, sternothyroid and thyroid, so sternothyroid is Santa again. And then thank you. Santa, oh Santa, thank you. Alright, so infrahyoid muscles. So Santa comes down the chimney, so that's like infrahyoid muscle, right? So it comes down. Alright, so Santa, oh Santa, thank you. Alright, so let's study each muscle in detail. Platysma, like I said, it's a part of superficial muscle, and platysma is literally a plate. Origin is subcutaneous tissue of infraclavicular and supraclavicular regions. So infra and supra. Okay, whenever you have supra means superior, infra means inferior. So supra, infraclavicular regions. That's the origin. So it originates from here. Alright, insertion, the base of mandible. This is the mandible, and that's where it inserts skin of cheek and lower lip. Alright, so skin of cheek, cheeks, and lower lip muscles are not only attached to bones, but they're also attached to the skin, right? So, skin of cheek and angle of the mouth, right? This is the angle of the mouth, and orbicularis oris. This part is orbicularis oris, right? Innervation, cervical branch of the facial nerve, so that is CN7, right? Facial nerve is CN7. Action is draws the corners of the mouth inferior and widens as in expressions of sadness and fright, right? So as you can see, it widens the mouth. So you can actually take your mouth, you can widen it and take it below, right? So it opens the mouth, right? Also draws the skin of the neck superiorly when teeth are clenched. Also it draws the skin of the neck superiorly. So you will draw the skin of the neck superior when the teeth are clenched, right? So this particular muscle helps in doing that. Branches of submental artery, and suprascapular artery. So suprascapular would be in the back. So submental and suprascapular artery. Sternocleidomastoid, right, is also a superficial muscle, right? The origin is the manubrium. This is manubrium, and the medial portion of the clavicle. This is the clavicle, this is the median portion, right? So this is the medial portion, right? Alright, so medial is closer to the body, so that's medial, right? closer to the middle body. All right, insertion is mastoid process. This is the mastoid process of the temporal bones. So temporal bones, right? And superior nuchal line. So there's also superior nuchal line, which is where it inserts in the back, right? Innervation, motor, spinal accessory nerve, sensory, cervical plexus, proprioceptive ventral rami of C2, C3, all right? So sensory is cervical plexus, motor is spinal accessory nerve, and proprioceptive is ventral rami of C2, C3, right? So sternocleidomastoid is a superficial muscle. This is exactly how it looks, right? So if this is your neck, as you can see, if this is your neck, these are sternocleidomastoid because it helps your neck stay erect. Without these muscles, chances are you'll have some really tough time, moving your neck contralaterally in cervical rotation, right? So sometimes we can actually do cervical rotation, right? Ipsilaterally, cervical flexion bilaterally, right? Cervical flexion, elevation of sternum, and assist in forced inhalation. Whenever you inhale forcefully, you will actually feel that it elevates your sternum, right? So it elevates your sternum, this area, it elevates it. Blood supply is occipital artery and superior thyroid artery. The occipital artery and superior thyroid artery are the one that are supplying blood. All right, digastric, okay, is a suprahyoid muscle superior to the hyoid bone, right? Anterior belly, digastric fossa, that's the origin. As you can see in this picture, this is the digastric fossa, this is posterior, and this is anterior. Digastric, right? So this is actually where you chew and you would store the food, and in the back sometimes you can throw it and you can store the food, right? So this is a posterior belly of digastric. This is a body of mandible, you know, the perfect shaped jawline, right? And this is the anterior belly of digastric. All right, so anterior belly, digastric fossa, mandible, posterior belly, mastoid notch of temporal bone. So there are two origins, mastoid notch of temporal bone and digastric fossa, mandible and posterior belly, okay? Insertion, intermediate tendon hyoid bone. So that's where it inserts, intermediate tendon hyoid bone. There you go. Innervation is anterior belly, mandibular division V3 of the trigeminal CN5 via the mylohyoid nerve. Posterior belly is facial nerves, right? So we have two innervation. One is CN5 and CN7. So one's facial nerve and one's the trigeminal nerve, right? What's the action? Opens the jaw when the masseter and the temporalis are relaxed. Blood supply is anterior belly, submental branch of facial artery. Posterior belly, occipital artery, right? So we not only have an anterior side, but we also have a posterior side, and obviously we'll have two arteries providing each. So submental branch of facial artery, and then posterior belly occipital artery, right? So we not only have two nerves, we also have two arteries providing it, right? And here's the genie for you. A digastric is a genie. Why? Because as you can see, it has curls like that, and I thought if you see the genie, you will remember them. So digastric is more like the genie's beard. Right? So I hope that helps. Alright, mylohyoid is a suprahyoid muscle, right? Looks like an ice cream cone. So if you're a big fan of crispy cone, this is like an ice cream cone. You know, if you stick this cone, you know, under your mandible and between and hyoid bone between two, you feel like there is actually a mylohyoid bone there, right? Okay. What is the origin? The origin is mylohyoid line. You know, this is the mylohyoid line. Insertion, body of hyoid and median ridge, right? So insertion is right here. Body of hyoid bone and median ridge. Innervation, mylohyoid nerve from inferior alveolar, branch of mandibular nerve. Raises, what's the action? It raises the cavity floor. So this is the oral cavity floor, and it raises it, right? Elevates the hyoid, elevates the tongue. Here you have a tongue inside, and depresses the mandible, right? So it does a lot many things. Why? Because it's actually connected to so many portions. Like it raises oral cavity, elevates the hyoid bone, elevates the tongue, depresses the mandible, right? So it has a lot many actions for many parts of the face, right? And the neck. Blood supply, Mylohyoid branch, inferior alveolar artery, and submental artery. Yep, because it is connected to multiple parts of the face. That's why you have submental artery of facial artery and mylohyoid branch of inferior alveolar artery. And they're also nerves. So mylohyoid nerve, inferior alveolar branch of mandibular nerve, right? So we have mylohyoid nerve and we have a mandibular nerve, right? Why do we have mandibular nerve? For example, you're not only doing the oral cavity, you're not only elevating the hyoid bone, that's where the mylohyoid nerve comes in. You're also depressing the mandible, so that's also mandibular nerve, okay? So wherever if you remember the actions, chances are, if you understand the location of the nerves and arteries, you'll remember everything, okay? Alright, so geniohyoid, suprahyoid muscle, right? Genio is a standard prefix for chin. And if you remember lingua franca, I think you will remember, the wordings for this particular muscle. So this is the geniohyoid muscle, this particular muscle. It looks like a skating ramp. Okay, so whenever you see a geniohyoid, remember the skating ramp. Inferior mental spine of mandible. So if this is the mandible, this is the inferior spine, mental spine of mandible. Insertion is hyoid bone. So if this is the hyoid bone, this is your insertion, right? Innervation is C1 via the hypoglossal nerve, right? So hypoglossal, right? Action is carry hyoid bone and tongue upward during deglutition, right? So let's say if you carry hyoid bone and tongue, try to attach your tongue to to your palate, and you will feel that you're kind of using this particular muscle, right? The blood supply is branches of lingual artery, right? So if you try to attach it, you'll actually feel that you're moving your geniohyoid muscle, okay? This is suprahyoid muscle, which is superior to the hyoid bone, right? So remembered by the skater's ramp, right? As you can see, it's a skater's ramp, right? Stylohyoid, a suprahyoid muscle, okay? So when I saw this, it kind of reminded me of chewed chopsticks because that's how they're placed as, right? So origin is styloid process. Insertion is greater cornu of hyoid bone, right? So if this is a hyoid bone, right? This is a hyoid bone. This is the greater cornu, these sides, and that's a greater cornu. So that's where the insertion is. The origin is styloid process, right? Innervation is facial nerve CN7, so that's the innervation. Action is elevate the hyoid during swallowing. So let's say if you're swallowing, it elevates it. Every time you try to eat, chances are you will be using stylohyoid muscle, right? So every time you eat, just think of stylohyoid muscle and say thank you, and that's how you'll remember what stylohyoid is, okay? Alright, so blood supplies branches from the facial, occipital, and posterior auricular arteries, right? So posterior auricular arteries, auricular are muscles behind your ears, around the temporal area, right? So that's why you're using posterior auricular arteries, in the back, alright? So there are three auricular muscles. One is superior, inferior, and posterior, alright? Alright, sternohyoid is an infrahyoid muscle, manubrium of sternum. So this is the origin, manubrium of the sternum, as you can see. Insertion is hyoid bone. This is where the insertion is. Innervation is C1, C3 by a branch of ansa cervicalis, right? Action is depressing the hyoid bone. So it depresses the hyoid bone. It pulls it down. Blood supply, superior thyroid branch of the external carotid artery. Superior thyroid, because there's thyroid here, branch of external carotid artery. Okay, so remember that this is the first time we have a carotid artery that's playing a role. So if someone asks you which artery provides blood supply to sternohyoid, remember the word sterno and hyoid, okay? Alright, so as you can see, it looks like two bridges. It looks like a bridge between sternum and the hyoid bone, and that's why you have two bridges. Why? Because it connects both, right? And that's why I said it depresses the hyoid bone. It puts it down, okay? Omohyoid. Omohyoid is an infrahyoid muscle. Origin is upper border of scapula. As you can see, it's going back. Can you see that? So, upper border, so this is the upper border of the scapula, inferior belly, intermediate tendon, that's superior belly. That's where the origin is. Insertion, intermediate tendon of inferior belly, hyoid bone, so this is the hyoid bone, superior belly, alright? So, as you can see, this is a hyoid bone, and that's where the insertion is. Innervation is ansa cervicalis C1, C3. The ansa cervicalis is a loop formed by muscular branches of the cervical plexus, formed by the branches of cervical spinal nerve C1, C3. So anytime when someone says ansa cervicalis, it's C1 and C3, right? Action depresses the larynx and hyoid bone. Also carries hyoid bone backward and to the side. Also, so it depresses the larynx and the hyoid bone. So it depresses them and also carries hyoid bone backward and to the side. So it also carries it backward onto the side, right? Blood supplies ITA, branches from the inferior thyroid artery. All right, so that's ITA. All right, so innervation is C1, C3, and branches from the inferior thyroid artery. Alright, so you can actually remember it like two snakes. Alright, so there are two snakes coiled up, right, around an ice cream or a milkshake, right? So as you can see, there are two snakes coiled up around the milkshake. You can take this as a milkshake, right? So that's omohyoid, right? Oh my god, you know, hyoid, like that. So omohyoid. Alright, so upper border scapula. Alright, so upper border scapula, intermediate tendon, that's superior belly. Intermediate tendon is where the insertion is, hyoid bone. Innervation is ansa cervicalis C1, C3. Action is depressing the larynx and the hyoid bone. Also carries hyoid bone backward and to the side. Blood supply is branches for the inferior thyroid artery. Alright? Sternothyroid infrahyoid muscle, right? So it's inferior to hyoid. Origin is manubrium, right? So this is the origin. That's the manubrium, right? Insertion is thyroid cartilage. So insertion is thyroid cartilage of the larynx. So right here, right? Thyroid cartilage is where the insertion is. Innervation is ansa cervicalis C1, C3, right? We just learned it's a loop. Action is depresses the thyroid cartilage. So it depresses the thyroid cartilage. This is the thyroid cartilage, and it depresses it. Blood supply is superior thyroid artery. So it supplies, so superior thyroid artery supplies the blood, right? The sternohyoid is located superficial plane of neck, while a sternothyroid is located in the deep plane underneath the sternohyoid. So there is a difference between sternohyoid, right? This is sternothyroid, and what we learned before was sternohyoid. Sternohyoid is right here. This is sternothyroid. As you can see, this is in the deep plane, right? It's really deep, right? And sternohyoid is, this is where the sternoid is. It is superior, right? It's superficial. This is sternohyoid. Alright, so this is sternothyroid, and this is sternohyoid, and that's omohyoid. It goes like this, right? And this is thyrohyoid. As you can see, this is particular is thyrohyoid, right? So this is a deep plane muscle, whereas sternohyoid is a superficial plane muscle. Okay. Thyrohyoid, infrahyoid muscle, inferior to the hyoid muscle. Origin is thyroid cartilage of the larynx, somewhere in the middle here, right here. Insertion is hyoid bone. Innervation is first cervical nerve, C1 via hypoglossal nerve. Alright. Action is elevates the thyroid and depresses the hyoid bone. So it elevates the thyroid, but depresses the hyoid bone. Blood supply is superior thyroid artery. So blood supply is superior thyroid artery. Thyrohyoid, the minute you hear thyrohyoid, it has to be thyroid cartilage. It has to be hyoid bone because the name says it. It has to be first cervical nerve C1 via the hypoglossal nerve. It has to play some role with the hyoid bone. Mostly it's usually depression. Yeah, there's only one muscle that was elevating it. And and elevates the thyroid, right? Because the name says thyro. Blood supply is superior thyroid artery. Alright, so rectus capitis anterior. Now rectus capitis, this is the rectus capitis, as you can see. Anterior, this is anterior vertebral muscle, right? As you can see, it's a V-shaped muscle. It's very easy to identify rectus capitis, right? Origin is anterior surface of lateral mass and transfer process of atlas. All right, so this is the origin. Anterior surface of the lateral mass and transverse process of the atlas, right? Insertion is inferior surface of basilar part of occipital bone. So this is a basilar part. This is the basilar part of occipital bone. Innervation, anterior rami of spinal nerve C1, C2, right? Anterior rami of C1, C2. Action, atlanto-occipital joint head flexion. So that's atlanto-occipital joint, where atlas and occipital bone joins, it's head flexion, right? So that's what they're saying. The action is head flexion, right? A blood supply is vertebral artery, ascending pharyngeal artery. So we have vertebral artery, and we have ascending pharyngeal artery. That's flowing supply. Okay. Rectus capitis lateralis, right? So this is an anterior vertebral muscle of the neck, right? As you can see, they kind of look like they're vampire-like. So the greens right here, they look like vampire-y, right? So upper surface of the transverse process of the atlas, inferior surface of the jugular process of the occipital bone. So as you can see, this is like an inferior surface of the jugular, right? Innervation anterior rami C1, C2. Action is ipsilateral flexion. So it equals on both the sides. Stabilize atlanto-occipital bone. So it is used to stabilize the atlanto-occipital joint, right? Blood supply, branches of occipital, vertebral, and ascending pharyngeal artery. Longus capitis, right? So longus capitis, anterior tubercles of transfer process of C3, C6. So that's the origin, C3, C6, right? Basilar part of the occipital bone is where the insertion is. Basilar part of occipital bone, right? So that is the insertion, right? Innervation anterior rami of spinal nerve C1, C3. Action is bilateral contraction, head flexion, head rotation, unilateral contraction, and head rotation. Blood supply is ascending cervical artery and the inferior thyroid artery. So blood supply is ascending cervical artery and the inferior thyroid artery, right? So remember this person, Master Shifu from Kung Fu Panda, and you see how he has little mustache. So every time someone says longus capitis, you can think of this picture, and that will kind of remind you of this little mustache type of muscle, right? That starts from the basilar part of occipital bone. If you remember one, chances are other things will follow, okay? Longus colli, anterior vertebral muscles, and that's more like Santa Claus, right? Because as you can see, they're really long. It looks like a beard. Origin, superior part, anterior tubercles of transverse processes C3, C5. That's where the origin is. Intermediate part, anterior surface bodies of vertebrae C5, T3, right? So it has three parts, superior, intermediate, and inferior. Inferior part is anterior surface of bodies of vertebrae T1, T3, all right? So that's where the origin is, T1, T3, okay? Insertion, superior part, anterior tubercle of vertebrae C1, right? Intermediate part, anterior surface bodies of vertebrae C2, C4. Inferior part, anterior tubercles of transverse process of vertebrae C5, C6. Innervation, anterior rami of spinal nerve C2, C6. Action, bilateral contraction, neck flexion, unilateral contraction, neck, contralateral rotation, neck lateral flexion, ipsilateral. Blood supply, branches of vertebral, ascendant pharyngeal, and inferior thyroid arteries. Alright, so blood supply. Branches of vertebral, ascending pharyngeal, inferior thyroid arteries. Lateral neck vertebrae muscle. Lateral is scalene, right? So remember what are lateral neck vertebral muscles? Lateral is scalene, alright? The lateral neck muscle is also called the lateral vertebral muscle, or a group of muscle that pass obliquely along the lateral sides of the neck, alright? So obliquely. This include the anterior, middle, and the posterior scalene muscles, which extend between the transverse process of the cervical vertebrae and the upper two ribs. Due to their attachments, these muscles mainly produce ipsilateral flexion of the neck, right? So this is the scale, and remember that lateral is scaly. Remember the scale, so you remember scalene, right? So it has three parts, right? Alright, so anterior scaling muscle, anterior tubercle of transverse process of vertebrae C3, C6, insertion scalene tubercle of rib 1, superior border of rib 1, anterior to subclavian groove, innervation anterior rami of spinal nerve C4, C6, action bilateral contraction, neck flexion, unilateral contraction, neck lateral flexion, neck rotation, elevates rib 1, blood supply, ascending cervical branch of the inferior thyroid artery. Middle scalene muscles, transverse process of C1, C2, C7, specifically posterior tubercles of transverse process of vertebrae C3, C7, superior border of rib 1, posterior to subclavian groove, innervation anterior rami of spinal nerve C3, C8, action neck lateral flexion, elevates rib 1, blood supply, ascending cervical branch of inferior thyroid artery. So that's middle scalene. This is the middle scalene. So as you can see, neck lateral flexion elevates rib 1. So it is originated from rib 1, as you can see. You see? Superior border of rib 1, right there. Alright, so as you can see that. Anterior rami of spinal nerves, C3, C8. Neck lateral flexion elevates rib 1. Posterior scalene muscles, origin is posterior tubercles of transverse processes. Vertebral C4, C6, C5, C7. Insertion is external surface of rib 2. Alright, so if this is the posterior scalene muscle, this is the rib 2, external surface of rib 2, right? As you can see, the reason why it's posterior and rib 2, because it's on the posterior side, as you can see all the the processes. Okay, innervation anterior rami of spinal nerve C6, C8. Action is neck lateral flexion, elevates rib 2, ascending cervical branch of inferior thyroid artery, superficial cervical artery. Alright, so posterior neck muscles. The posterior aspect of the neck is covered by muscles that connect the skull to the spinal column and pectoral girdle. These muscles can be divided into three layers. One's a superficial layer, so trapezius, splenius capitis, and splenius cervicis, right? So tiger saw cat and said cute. Okay, so trapezius, splenius capitis, and splenius cervicis. Tiger saw cat and said cute. Okay. Deep layer muscles are cervical transversospinalis muscles, and spinalis capitis, semispinalis cervicis, multifidus cervicis, right? So creamy, so cold, more cafe, alright? So you go to Starbucks and you ask for so creamy, so cold, and more cafe. You want more caffeine, right? So that's like deep layer. So when you make coffee like that, it gets really thick, it gets really deep. So creamy, so cold, more cafe. Semispinalis capitis, semispinalis cervicis, multifidus cervicis, right? Deepest layer, suboccipital muscle, interspinalis cervicis, and intertransversi colli muscles. So much ice cream can increase cough and mucus, right? So much ice cream. So deepest layer, suboccipital muscle, interspinalis cervicis, intertransversi colli muscles. So much ice cream. Should remind you of suboccipital muscles. Ice cream should remind you of interspinalis cervicis. Colli muscles can increase cough, mucus. Okay. Trapezius. So trapezius is the descending. The origin is descending part, superior fibers, medial third of superior nuchal line, external occipital protuberance, nuchal ligament, transverse part of spinous processes, supraspinous ligaments of vertebrae T1, T4, C7, T3. Ascending part is spinous process, supraspinous ligaments of vertebrae T4, T12, right? Insertion, descending part, lateral third of clavicle, right? Transverse part, medial acromial margin, superior crest of spine of scapula. Ascending part, lateral apex, medial end of scapular spine. Innervation, motor accessory nerve, right, CN11. Motor sensory anterior rami of spinal nerve C3, C4, right. Action is descending part, superior fibers, scapulothoracic joint. Draw scapula superomedially, so it's not only superior but also medially. Atlanto-occipital joint, extension of head and neck, and lateral flexion of head and neck, right? So it's ipsilateral, equal on both sides. Atlantoaxial joint, rotation of head contralaterally, so the muscle on the left will work on the right direction and the right muscle will turn on the left direction. Transverse part, middle fibers. Scapulothoracic joint, draw scapula medially. Ascending part, inferior fibers. Scapulothoracic joint, draw scapula inferomedially. So it's not only inferior, but also bringing inside, right? So when you get scared, that's when you're like, oh my God. Or when you're sad, you'll feel like, your scapula is like inferomedially. Blood supply, occipital artery, superficial of transverse cervical artery, and also dorsal scapular artery. So it's not just the occipital artery, it's also superficial transverse cervical artery, right? And the dorsal scapular artery. So whenever someone says trapezius, always remember the picture of the Superman on the back, right? As you can see, this is really large muscle in the back, and this is your scapula, right? And that's why it's not only moving it inferomedially down, but also upwards, right? As you can see that. Splenius capitis, superficial layer, right? So splenius capitis, this is the splenius capitis, spinous process vertebrae C7, T3, nuchal ligament, right? So this is where the origination is, C7, T3, C7, T3. Insertion lateral, superior nuchal line of occipital bone, mastoid process of temporal bone, they're talking about right here. Innervation is lateral branches of posterior rami of spinal nerve C2, C3, right? C2, C3. Action, bilateral contraction extends head, neck, unilateral contraction, lateral flexion, and rotation of the head. All right, so bilateral contraction, unilateral contraction, and rotation of the head, ipsilateral, right? Blood supply, muscular branches of occipital artery. So whenever someone talks about splenius capitis, it should remind you of this shiny diamond shape, right? So it looks like a diamond, right? As you can see that the way a diamond has many, it reminds you of splenius capitis, right? So whenever someone shows you a muscle on cadaver that looks like a diamond, yeah, and it's around this area, it has to be splenius capitis. Splenius cervicis, superficial. So as you can see, it looks like two swans coming together, right? As you can see, 1, 2, 3, 1, 2, 3. It feels like there are two swans coming to us, the neck of the swans, right? The origin is spinous process T3, T6, right? So that's the origin. Insertion is transverse process of C1, C3. So that's like transverse process, all right? Lateral branches of posterior rami of lower cervical spinal nerves. So lateral branches of posterior rami of lower cervical spinal nerves. Action, unilateral contraction, lateral flexion, rotation of the neck on both sides. Bilateral contraction, extension of the neck. Alright, so it's extending the neck, right? Blood supply, vertebral, occipital, superior intercostal, deep cervical, transverse cervical arteries, right? So as you can see, it is provided blood supply by multiple arteries, vertebral artery, occipital artery, superior intercostal, deep cervical artery, and also transverse cervical arteries. It is a superficial layer muscles, right? Splenius cervicis, all right? Semispinalis capitis muscle, which is a deep layer muscle, right? So it is a deep layer muscle, right? It is on the deep plane and not superficial, right? Articular process of vertebrae C4, C7, and transverse process of vertebrae T1, T6. Insertion between superior and inferior nuchal lines of occipital bone. Superior, inferior nuchal lines of occipital bone. Innervation, descending branches of greater occipital nerve C2 and spinal nerve C3. Action is bilateral contraction, extension of head, cervical and thoracic spine. Unilateral contraction, lateral flexion of head, cervical and thoracic spine. Ipsilateral rotation of head, cervical and thoracic spine. Contralateral, right? So it has multiple actions, mostly bilateral, unilateral, and also contralateral, cervical and thoracic spine, right? The blood supply is occipital artery, right? Where it originates from, right? So you can actually remember this. Semispinalis capitis deep layer. You can remember this particular picture. As you can see, the braids are very deeply done. So semispinalis capitis muscle, deep layer muscle, right? So you can remember it by that. Splenius cervicis. So because it's in the cervical area, they're calling it cervicis, right? Now this one is in the capitis area. Why? Because it's connected to the cap, the occipital bone, superior inferior, right? If you go back here, you can see the same thing. Splenius cervicis muscle, superficial layer. Why? Because it's connected to the cervical area, right? Alright, so semispinalis cervicis muscle, deep layer, right? Remember this particular dragon? You know how it was flying in this direction? Remember that, because that's exactly how it's connected to the spinous process. To the spinous process. As you can see, it's coming from the spinous process. Origin is transverse process. Insertion is the spinous process. Innervation, medial branches of posterior rami of the spinal nerves. It's connected to the spinal nerves, right? Action is bilateral contraction, extension of the head, cervical and thoracic spine. Why? Because it's connected to all of them. Unilateral contraction, lateral flexion of head, cervical and thoracic spine. Ipsilateral rotation of head. It rotates the head, cervical and thoracic spine. Contralateral. Blood supply, occipital, deep cervical and vertebral artery. So it's not only occipital artery, it is also deep cervical artery. It's coming from the cervix, and also the vertebral artery, right? So they also have vertebral arteries. Multifidus, deep layer muscle. Multifidus cervicis, superior articular process of vertebrae C4, C7. Multifidus thoracis, transverse process of thoracic vertebrae. Multifidus lumborum, mammillary process of lumbar vertebrae. Posterior aspect of sacrum. Posterior superior iliac spine, PSIS, of ilium and posterior sacroiliac ligament. Insertion, lateral aspect and tips of the spinous process of vertebrae 2 to 5 levels above origin. Innervation, medial branches of posterior rami of spinal nerves. Action, bilateral contraction, extension of spine. Unilateral contraction, lateral flexion of spine, rotation of spine. Blood supplies vertebral artery, deep cervical artery, occipital artery, posterior intercostal artery, subcostal artery, lumbar arteries, and lateral sacral arteries. So blood supplies from multiple arteries, as you can see here. That's only because of the space that it covers. Okay, so remember this is the deepest layer. These are all multifidus, alright, cervicis, thoracis, and lumbar. Okay, so 1, 2, 3, very deep layer muscles. Okay, rectus, capitis, posterior, major suboccipital muscles. This one's the deepest layer. Remember the mantis, right? They had a mantis in the movie Kung Fu Panda, so you can remember that. It is rectus, capitis, posterior, major suboccipital, right? Spinous process of axis, as you can see, the origin is sinus process of axis. Insertion is lateral part of inferior nuchal line. This is the inferior, as you can see. This is the nuchal line, and here is insertion, right? So muscles not only connect to the skin from the inside, they also connect to the bones. Right? Insertion is lateral part of inferior nuchal line of the occipital bone. Innervation is suboccipital nerve, posterior ramus of spinal nerve C1. Action is bilateral contraction at the atlanto-occipital joint, head extension. Unilateral contraction at atlantoaxial joint, head rotation. Blood supply is vertebral artery and descending branches of occipital artery. So blood supply, vertebral artery and descending branches of occipital artery. Rectus, capitis, posterior minor suboccipital muscle, that's the deep layer. Okay, so remember this is the deep layer. We just saw, yeah, inferior nuchal muscle, right? We just saw that. We remembered mantis. Remember this V shape right here? The closest to the medial, all right? Rectus capitis, posterior minor. Why it's small? That's why. Origin, posterior tubercle of atlas. Insertion, medial part of inferior nuchal line. So this is the inferior nuchal line, and this is the medial portion, median part, nuchal line of occipital bone. Innervation, posterior ramus of spinal nerve C7. Action, bilateral contraction, atlanto-occipital joint, head extension. Blood supply, vertebral artery, occipital artery via the deep descending branch. Okay, so remember this V-shaped, and remember that it's a deepest layer. All right, it's a minor. So the minute they say minor, you should think about the smallest muscle, right? Obliquus capitis inferior, a suboccipital muscles, deepest layer. So that's the obliquus capitis, right? This is the obliquus capitis. Okay. Transverse process of atlas. Transverse process of atlas. Spinous process of axis. So this is your axis, and these are your spinous process. It is originating from the spinous process. Insertionist transverse process. This is your atlas, the first vertebrae. This particular place is your insertion, right? Innervation, posterior ramus of spinal nerve C1. Action is bilateral contraction, atlanto-occipital joint, head extension. Unilateral contraction, atlanto-axial joint, head rotation, ipsilateral. Blood supply, vertebral artery, and deep descending branches of occipital artery. So blood supply is vertebral artery and deep descending branches of occipital artery. Deep descending branch of occipital artery, right? Obliquus capitis superior, suboccipital muscle, deepest layer, right? Initially we had a vampire, now we have a panther, only because the size of this small muscle, very small, right? Transverse process of atlas, right? So the origin is transverse process of atlas. This is your atlas, and that's where it originates from. Insertion is occipital bone between superior and inferior nuchal. This is superior, this is inferior nuchal line, okay? All right. Innervation, suboccipital nerve, posterior ramus of spinal, right? Nerve C1. Action is bilateral contraction at atlanto-occipital joint, right? Head extension, unilateral contraction, atlanto-axial joint. Head, lateral flexion, ipsilateral. Blood supply, vertebral artery, descending branches of occipital artery. Okay, so that's the blood supply. All right, so let's... Interspinalis cervicis is the deepest layer. Interspinalis cervicis, superior aspect of spinous process of vertebrae C3-T1. Interspinalis thoracis, superior aspect of spinous process of vertebrae T2, T11, T12. Interspinalis lumborum, Interspinalis lumborum, superior aspects of spinous process of vertebrae L2, L5. Insertion into spinalis cervicis, inferior aspect of spinous process of vertebrae C2, C7. Interspinalis thoracis. All right. So when it talks about cervices, as you can see, it is C2, C7. When it talks about thoraces, as you can see, it's T1, T10, and T11. Right. Interspinalis lumborum. That's when they talk about inferior aspects of spinous process of vertebrae L1, L4. Right. All right. Innervation, posterior rami of spinal nerves. Action, extension of cervical and lumbar spine. Blood supply, interspinalis cervicis, vertebral artery, deep cervical artery, occipital artery, transverse cervical artery. And for interspinalis thoracis, it's superior intercostal artery, posterior intercostal artery, and subcostal artery. Interspinalis lumborum is lumbar artery. So when it talks about thoracis, it is intercostal, posterior intercostal, superior intercostal, and arteries, and subcostal artery, right? So it's pretty self-explanatory. All right, so as you can see, this is the interspinalis cervicis, right? Posterior intertransverse colli muscles, That's a deep layer. Transverse process of cervical vertebrae. These are all cervical vertebrae. Insertion transverse process of adjacent vertebrae. So it inserts on each adjacent vertebrae. Innervation posterior anterior rami of spinal nerves. Action helps stabilize the cervical vertebrae and may be involved in proprioception. Okay, so what is the action? It helps stabilize the cervical vertebrae and may be involved in proprioception. Right, so the action is stabilization of cervical vertebrae and may be involved in proprioception. Blood supply ascending cervical artery. So blood supply is ascending cervical artery. Intertransversory colli muscles, the deepest layer. Okay, so transverse process of cervical vertebrae. This is the cervical vertebrae. Transverse process is, like this. No, this is a spinous process. This is a transverse process. Transfer process of adjacent vertebrae. Every other vertebrae is insertion, right? Anterior rami of spinal nerves. Anterior rami of spinal nerves. If this is your spinal cord, anterior rami of spinal nerves. Action is assist in lateral flexion and of the cervical spine, stabilizes the cervix. Not only helping lateral flexion, so lateral on the side to side flexion, and stabilizes the cervical spine. Blood supply occipital, deep cervical and vertebral arteries. Those blood supplies occipital, deep cervical and vertebral arteries. Alright, so thank you for watching. Those were neck muscles. If you really like this video, please subscribe, like, share with your friends, and comment, and let me know how I explained the neck muscles. Bye.